I would break that that whole area into two sections. The first would be diagnosing primary headaches. And these are the headaches like migraine, tension type headache, cluster headache, and some other primary headaches where we really don't know the ultimate cause, the ultimate mechanism, although, of course, there's a cause. We call them primary because the cause is mysterious. And then the area of secondary headaches, which includes things like mass lesions, infections, inflammatory disease, intracranial pressure abnormalities, things that our patients are worried about. And, I think a good philosophical approach to diagnosing a headache would be to first think about the possibility of secondary headaches, things that really we need to know about in a pretty expedited way. And once we do that, once we've excluded those secondary causes, we get into this differential diagnosis within the primary headaches. And there is a classification system called the International Classification of Headache Disorders. We're in our third edition. It's very thorough, very extensive, yet a lot of these primary headaches have definitions that overlap. For example, migraine has specific criteria for diagnosing, but chronic migraine becomes a little bit more like chronic tension type headache and can overlap into other headache types, even secondary headache types. Tension headache has been a difficult area for a long time. It's defined actually by sort of what it's not rather than what it is. We know very little about it. Some of the diagnostic categories in the third chapter of the classification, which is cluster headaches and its relatives, have a lot of overlap. And some of the headaches in the fourth chapter, called other primary headaches, have very strong similarities to other primary headaches like migraines. So we have these clearly written diagnostic criteria, yet they may not explain the whole field. So luckily, this classification exists as kind of a fluid document and is based on evidence. And as evidence presents itself, the classification will change. I think that nonetheless, it's very important that we all try and use that classification. It still is a good tool for diagnosis and a good tool for treatment, because even though treatment may overlap, it's good to have a place to start. I think it expedites successful treatment. And, there's no way to move our field forward in the headache medicine field if we don't segregate patients into different categories.